A few years ago, I was privileged to attend a lecture by Doris Kearns Goodwin, the award-winning historian. And she was speaking to a room filled with nursing leaders from around the country. And she said something that has really stayed with me, that struck me at the time and beyond. And she said that nursing really needs to embrace its past because its past is filled with luminaries. But then she also went on to say that nursing must embrace its present because its present is likewise filled with amazing people, luminaries who have made amazing contributions. And it dawned on me that although we try, we really don't do either one of those things as often as we should. And so one of the first things that I did as dean was to create the Dean's Award so that we could recognize these luminaries and really recognize their contributions. So that award can be in one of three categories. It can be in lifetime achievement, leadership, or community service. And it's not given every year. It's given when there's someone or some people who are so outstanding that we have to pause and recognize them. And so tonight, this will be the first time that we are awarding, that I am awarding, the Dean's Award, and the category is for lifetime achievement. And there are two recipients. The first recipient is Dr. Dula Pacquiao, a celebrated trailblazer. There's an old country song that was recorded by Barbara Mandrell that was entitled, "I Was Country When Country Wasn't Cool." Well, I know nothing about country music except that title really stayed with me because it spoke to me of someone who is ahead of their time. And truly, Dr. Pacquiao is ahead of her time and was ahead of her time when she started her work. She was studying, writing, and advocating for culturally competent care and health equity long before it was cool. Long before its importance was recognized by AACN, and long before it became required content in all nursing degree programs. So thank you, Dr. Pacquiao. She is internationally recognized for her expertise in transcultural nursing, culturally competent care, and strategies to advance health equity. As one of the world's leading experts on these topics, she has provided consultation to the AACN, American Association of Colleges of Nursing, the Office of Minority Health, the California Endowment, the Sullivan Commission under the auspices of the U.S. Secretary of Health, the National Quality Forum, the Institute of Health in Botswana, Egypt's Ministry of Health, and the New Jersey Department of Health and Senior Services. And she is currently working with AACN to develop its toolkit on social determinants of health that is needed for all of us to implement the new curricula essentials. Dr. Pacquiao has published over 129 peer-reviewed articles and book chapters and 4 books published on culturally competent care and health equity. Most recently, she developed and is testing a new research instrument, a measure, to measure clients' perceptions of provider cultural competence. And already that instrument has been translated into Filipino, Mandarin, Spanish, and Portuguese. Dr. Pacquiao, thank you for your life-enriching, world-enriching, and world-renowned work. It's my honor to present you the Dean's Lifetime Achievement Award.
Honored guests, alumni, friends, and colleagues, I am so honored to accept this Lifetime Achievement Award. I wish to thank Dean Linda Flynn and Rutgers School of Nursing for giving me this award and this very beautiful plaque. Please know that I regret not being with you in person. This award is so meaningful to me because it recognizes my achievement as a nursing faculty member at Rutgers, a place that has allowed me many opportunities for much higher level accomplishments. I was able to pursue my lifelong interest in multicultural education, research, and practice. The joint PhD program expanded my understanding of social determinants of health disparities and the appreciation of how multi-sectoral interdisciplinary research and practice is key to making a difference in the life of conditions and the health of people. My collaboration with FXB Center gave me exposure to global education in Africa and the challenges of HIV prevention and care in different social culture contexts. My doctoral degree in education at Rutgers gave me a well-rounded foundation in multidisciplinary towards health and education. I was indeed fortunate to find a job that I enjoyed and learned much in the process. I am honored to be associated with Rutgers, its outstanding groups of nurses like Drs. Speck-Lau, Smoyak, DeMayo, Joel, Flynn, Salmond, and many more. I have to thank them for their legacy of excellence and leadership. Most of all, I am so indebted for the support of my family, my husband Lino, and my children Laurel and David, whom grew up with their mom always at school. Thank you and good evening.